Hello, it's Dr. Shelly with Shelly's Nursing Review in Cleveland, Ohio, and on YouTube with HETV. Now listen, everybody, I gotta tell you, I am excited. Did you figure it out? Did you guess? Do you know what I mean? Have you checked it out? Yeah, there's more on this in another video, but just suffice it to say, this video, stay focused, this video is another breastfeeding video in which we talk about the benefits of breastfeeding for the baby. Okay, so far you should have seen that we have the benefits of breastfeeding for mom. We have quickie breastfeeding tips for nurses to teach the patient and their family. And this one is breastfeeding benefits for the baby. Now, somewhere in the midst of that is a couple videos on how you can win a free review and how you can win half off of anything I have to offer, except the self-study program. So for right now, you stay tuned to all of that later, but for right now, let's dive into this video. Now, the breastfeeding benefits for both mom and baby are plentiful. This video and the other video about the breastfeeding benefits to mom, they're very near and dear to my heart because I feel like I was, like I was cheated a little bit, because when I was really young and unfortunately dropped out of high school pregnant, had my baby as a teenager, when that happened, I didn't know anything. Like you're stupid. You know you're stupid when you're a teenager and you have a baby. And so I went religiously, never missed a prenatal visit to the prenatal clinic. At that time, back in those days in the 80s, it was torture. Yeah, either you caught 2 or 3 buses to get to the freaking thing, and then you sat for what equated to be about 8+ hours or whatever. I mean, it was a long time just sitting, 6 to 8 hours doing nothing but waiting. And then you saw the doctor for 5 seconds who didn't even look you in the eye or remember your name. I don't remember his either. Then you saw the nurse, who I do remember her name, but back in those days, and I'm not sure why, she said nothing about breastfeeding to me. And then you go to the WIC office, and they're kind of fun because they have all these freebies for formula feeding, and never, ever, ever did it cross my mind, and never, ever did it cross their lips to talk about breastfeeding. They literally had these very beautiful packaged formula with baby rattles and baby bibs and baby blankets and all this free stuff. So the natural assumption was that bottle feeding is best. Well, I shouldn't say bottle, because bottle is just the equipment. But the natural assumption is that formula feeding was best for my baby. And we know that that's actually not quite right. So I was kind of upset. I was like, okay, the whole time I spent at this stupid clinic, and even with the social worker who I also had to see, even with that, I never got anything about breastfeeding. So my first child was bottle fed, and that's kind of good because I can speak from the heart, the head, and everything else about this issue. My second child was breastfed. I had been to college. I was already a nurse. I worked in labor and delivery. I had taught breastfeeding to moms already. And so I knew what I was doing, but it still, because I hadn't actually done it, it was an eye opener. Okay, so this should help you. I think it's coming from my heart and my head, you know, that PhD head of mine. It's coming from both, and I hope you get enough out of it to pass a test. And for you, yourself, and your family, you figure out, wow, the human body's amazing and God made no mistake. So let's get started. Number 1, the title of this video is Breastfeeding Benefits for the Baby. And also we will incorporate some baby-friendly initiatives in this talk. Now, this whole discussion takes into consideration what I call the ever versus never. It means if you ever breastfeed, these benefits to some degree can occur, versus never breastfeed. Then, well, who knows, but we'll see. All right. Now, the other issue I want to talk to you is about the recommendations, right? So the current Academy of Pediatric recommendations is that you breastfeed exclusively, if you can, your new child for the first 6 months. Then continue to breastfeed with food if you choose, although you didn't have to, but if you choose to start feeding your child regular food, that breastfeeding continues for actually, I hope you hear me loud and clear, 2 years. Yeah, I said 2 years. Now, unfortunately, what's going on in America right now is that's almost impossible, right? For a lot of women, because so many women go back to work. And I want to give a shout out to the Cleveland Clinic, who gives paid time off for every new mom, maternity paid time off for 3 months. Now, I know that doesn't sound like a lot of time either, but most jobs only give you 6 weeks. Yeah, back in my day, you might not have got that. Okay, so, you had to save up all this time, and if you didn't save it all and you took a vacation before you found out you were pregnant, you were kind of fucked. So whatever. I'm telling you, this is a huge, hairy deal. And let me just say for the record that Kamala Harris, or let me say it right, Kamala Harris supports paid family medical leave. So does her VP. Her VP is Tim Walz, and he established paid maternity leave for the entire state of Minnesota. I think he put his money where his mouth is. Just saying, side note. So yeah, whether or not you breastfeed for however long you breastfeed, you need to know it's a lot easier with paid maternity leave. It is also something else you need to remember. President Biden passed the law. He passed the law. He signed into law. He signed into law because legislators passed the law. But he signed into law what the legislators passed, Congress and the Senate, passed regarding breastfeeding friendly policies at the workplace. So us nurses really kind of need to hear this loud and clear, because the majority of nurses are female and the majority of those nurses are going to have children. Did you know that you're entitled to breaks to pump, and that does not count towards lunch or regular breaks? There should be allotments for you to take a break and pump, not in a bathroom, but in a locked room at the workplace, not a bathroom, and not in my unit, the endoscopy procedure room. That's gross. So there should be areas for you to pump at work. That's the law. And that pump break that you need to pump for your child cannot be considered part of your lunch break. So know the law, please, okay? Now, moving on to one more issue, Family Medical Leave Act. What you need to know is that even though this is not paid time off, the minute you get pregnant, you should be trying to get these papers signed that are easily downloadable at the government site. It's a .gov site, but just put FMLA paperwork into Google and you'll go right to the site and print down the papers. These papers are taken to your OBGYN. They sign them so that anytime you take them to HR. Oh my God, I almost forgot to say that. You take them to HR. President Clinton passed that law that you are entitled as a pregnant woman to take off without being fired. You may not be paid for it, but you can take off without being fired as long as you're working like a certain number of hours. The easiest way to say this, although it's not exactly right, is full-time employment in a company with 50 or more employees definitely qualifies you. And so one of the things that I think people in this country, women especially, and families in this country don't know is that as a family, you qualify for FMLA for a number of reasons. If your mother has cancer and you got to take her to chemo, if your dad, like my dad, has dialysis and you got to make sure he gets there, if your kid has asthma, if you have diabetes or Crohn's or ulcerative colitis or some other autoimmune disease like multiple sclerosis or lupus, you qualify for FMLA. Yeah, you guys, take advantage of what we do have and then look out for some more things we're gonna have if you vote. All right, moving on. So now we're gonna get to the 10 benefits of breastfeeding to baby. Here we go. Everyone knows the first one. It's the antibodies, stupid, right? It's the antibodies. Yeah, no matter what formula companies do, they have not managed to duplicate God. They have not managed to make a formula with antibodies in it. Now, antibodies ain't no joke. You know what I used to tell my patients? I would tell them, I get it. You might have to go back to work. I'm a mom. I had to return to work. In fact, I was also in school with both kids. So if you want to breastfeed, but not long, because you know you got to go to work, at least give that kid the first 3 days of milk. Because if you do, that's where the antibodies are. Now, there's antibodies in regular milk too, but the most of the antibodies, because he made no mistake, he's protecting his baby immediately, is in the first 3 days of colostrum. So this colostrum that your body produces the first 48, 72 hours. I mean, this is all you got. You start having it way before you even delivered your baby. And then as soon as you delivered your baby, it's ready to go. And it stays, and it's got all these antibodies, and it is inside of your breast for 48 to 72 hours. And then you get the milk coming in by day 3 or 4. But before your milk comes in, this colostrum is liquid gold. Hello? Yes, look. It is high calorie. Yeah. See, your baby's stomach is the size of a marble when they're first born. And in a couple of days, it's going to grow to the size of a golf ball. And so what we know as nurses is that this tummy is perfectly sized for the tiny amount of liquid gold that you start to produce. And the more they get the liquid gold out, the more you produce the real milk in another few days. But they got to get it out. So we encourage mom to room in with her baby, have skin-to-skin contact immediately after birth, nurse that baby in the first 30 minutes to an hour, so that that colostrum is given by golden drops to this brand new baby who needs to be protected against infection, okay? So this colostrum, which is number 2, the number 2 benefit of breastfeeding for baby, it's high in calories, so your baby is going to be fine. It is also going to be richer in blood sugar. Not blood sugar, but sugar, and help the baby stabilize their blood sugar. And remember, nurses, if this mother is a diabetic and her blood sugar was high during pregnancy, whether she was a diabetic before she got pregnant or if she's gestational diabetic, her baby is at really high risk for very low blood sugar. So the fact that you put this baby on the breast and gave them colostrum with its high sugar content, that's going to help that baby. Now, this colostrum has the antibodies, as we earlier stated, but it's also a freaking laxative with probiotics. Yes, what does that mean? Well, there's something called meconium, right? Meconium is the stool that the baby has when they're first born. Now, you know it's black and tarry, and this meconium stain, or this meconium stool that this child has, you know what you learned about black tarry stools. You know that you learned that black tarry stools was blood. It is blood, but it's maternal blood. And when the baby breastfeeds, it's a laxative. So it's going to help them pass their meconium, and it's going to help them protect their gut against infection and diarrhea and constipation. It's pretty fucking amazing. Yeah. So the first 3 days, remember that. You might have it on a test one day. First 48 to 72 hours is colostrum. Next benefit to baby of breastfeeding, right? So what else is going to benefit the baby when you breastfeed? Well, breast milk is specific to the baby's growth and development, to the time of day, and it's sterile. Oh my gosh. Listen to this, y'all. This is so cool. If your baby breastfeeds during the day, the daytime breast milk from you will give them specific nutrients to keep them active and awake. Yeah. When you give your baby breast milk at night directly from you, then your baby will get the specific nutrients in the breast milk to make them sleepy. It is amazing. And it's kind of interesting because, like, well, what if you pump? Well, you know, you pump, you put it in the fridge, you put it in the freezer. You're not going to remember if it's night or daytime milk. Who cares? But it's just so cool that he thought of everything, that even the hour of the day that you breastfeed is very specific to your baby's needs. That's fucking amazing. Just saying. All right. Now, the growth and development is also amazing because for the first 3 months, the breast milk that your baby gets is very high in fat. And then later on, when they don't need that fat and they're moving around doing their thing, you get other nutrients that are critical for this baby to start moving around. It's crazy. All right. Next on the list, number 4, we know this is from the antibodies, specifically antibody IgA. We already know that breastfed babies have less otitis media. Remember, I bottle fed and I breastfed, and this shit is true. Less otitis media, less pertussis, which is whooping cough, less RSV or respiratory syncytial virus, less pneumonia, less bacterial meningitis. We already knew that. That's why we always say, just if you can't breastfeed forever because you got to go back to work and your job is a bunch of bull crap, at least do 3 days. I pretty much had every patient whose baby I delivered, they were kicking it for 3 days, man. A lot of them did it longer, of course, but at least they did it for the 3 days to get that antibody-rich colostrum into their baby. I'm just saying. Obviously, the longer you do it, the more the protection. The next one is less autoimmune diseases like multiple sclerosis, lupus, and even rheumatoid arthritis. Wow. And again, these are all things that you can read for yourself, but I just want you to know what the benefits of breastfeeding to baby are. Okay. Less obesity, less diabetes, some cancers, and cardiovascular disease. The whole boy versus girl is pretty amazing. Do you know that your breast milk is geared towards the sex of your baby? Yes. So you have boy breast milk and girl breast milk. Now, the funny thing is, if you didn't even have a baby, you could still, as a woman, produce breast milk. They were called wet nurses back in the days, right? It's one of the things slaves had to do. Slaves had to nurse white babies because this mistress didn't want to do it or couldn't do it or whatever the deal is. I don't know. I wasn't there. But I will say for sure that Black female slaves that were even older were still producing milk as long as there was a baby on them. And they didn't even have kids that were babies. Now, their children might have been teenagers, and here they were still a wet nurse. That's what it was called. That's how amazing the human body is. Okay, so what I'm saying to you is that if you did just have a baby and that baby is nursing, that body, your breast milk knows the nutrients for a boy and the nutrients for a girl are slightly different. It's kind of amazing. Look it up. Less GI issues. Oh yeah, less gastrointestinal issues like constipation, inflammatory bowel diseases like Crohn's and ulcerative colitis, celiac disease, less lactose intolerance. Ooh, I will tell you from personal experience that this is true. My oldest daughter, when I brought her home, immediately she had constipation from this formula that I was feeding her. My baby had regular stools from minute 1, never got constipated until after a year of life when I wasn't breastfeeding anymore and I switched her to, regular milk or whatever. And I only nursed a little while because I was in school and work. So she transitioned to, formula sort of, quick, right? So the minute that started, here comes the constipation. It was just a pain in the ass, and it's just noteworthy. It just is what it is, you guys. No one can deny this. The microbiome of the baby's gut gets the probiotics, and now they say that some of the formulas are putting probiotics in there, and that's great. Because some moms just can't breastfeed no matter what. I know my daughter, my grandson had a tied tongue. She was bleeding. Then he was allergic to milk. He was having bloody stools. Oh, it was awful. She couldn't produce enough. She kept trying to do different things to produce more. It was awful. Okay? All right. Now, the other issue, the other benefit to baby when mommy breastfeeds is less SIDS. This has been very well documented. It may have everything to do with the fact that breastfeeding babies wake up more often. And so if they're in a situation where some position they were in may have caused them to have a poor outcome, they're waking up more often to nurse. And this is part of the reason why they think that. There is also less, look at this, infant mortality. And that's because when babies are born prematurely, they have a very high risk of something called necrotizing enterocolitis. This is very, very, very associated with formula feeding, so much so that if a mother can't breastfeed her premature baby, literally NICUs all over this country are giving these precious babies donor's milk to get that liquid gold colostrum in this baby and this liquid gold breast milk in this baby, because it's proven that breast milk will cause less incidence of necrotizing enterocolitis, something we call NEC in the NICU, and that those babies often are discharged a lot sooner than babies who aren't breastfed. There is even improved brain maturation, and some think it might lead to a higher IQ. There's too many factors that go into an IQ, but one thing we know for sure is that this breast milk has just the right type of fat and the right amount of fat. You know, fat gets a bad rap, which is terrible because I love a high-fat diet, seriously. But fat is critical for brain development. You know how that's true? You know how you know that's true for sure? Remember learning in nursing school that you cannot switch this baby from breast milk at a year of life to 2% milk or low-fat milk? Remember learning that? You had to switch the baby who was weaning either at 6 months or a year of life from the breast. They needed to be weaned into iron-containing, not iron containing, but they needed to be weaned if it was before a year of life and the baby was weaning, they needed to be iron supplemented formula. And if it was 1 year of life and they were weaning, they needed whole milk because of the fat content for brain development. I can't tell you, I knew people that I worked with way back in the day. I worked with this one girl. We were both pregnant at the exact same time. She was in the department I was in. She was eating low fat, no fat the whole pregnancy. When her daughter was born, she switched her when she weaned her to skim milk and everything. That child has learning disabilities. I need you to know this is real. Children need, babies, infants, newborns need fat for brain development. I often wonder if all this low-fat shit and fat-free shit was responsible for any problems with brains as children are growing. I just wonder. I'm just curious because, you know, we see a lot of ADHD and stuff like that where they're smart, they're intelligent, but they can't pay attention too long. I'm just saying, who knows? Who knows? Going forward, more benefits to baby. Breast milk is the perfect temp. You know, when you have a baby, you're exhausted, and some moms may not know they can never microwave food or breast milk for a baby. And so when you breastfeed, formula or breast milk, but when you breastfeed, it's a perfect temperature, right? You don't have to heat it up. So, oh, and by the way, we also need you to know that in addition to it being perfect, the perfect temperature, the perfect balance of nutrients, It's also perfect genetically because formula is still from a cow. It's cow's milk. Breast milk is human milk, okay? It's easily digested because it's genetically made for human, and it's a decrease in allergies and eczema in the children who breastfeed, okay? Now, the last or 10th benefit to babies who breastfeed is that it's literally considered medical treatment for a premature baby, especially those 32 weeks or less than 1,500 pounds, or 1,500 grams. So let me say that again. Breast milk is considered medical treatment for premature babies earlier than 32 weeks or less than 1,500 grams. Any premature baby, it's considered medical treatment, but it's almost like critical for those babies who are younger, because the younger you are, the more at risk you are for necrotizing enterocolitis, which is deadly, seriously deadly, okay? Now, this necrotizing enterocolitis, we see a 60% reduction in babies who breastfeed. It's critical. It's a big deal. Now, let me say this in conclusion. If you didn't or you can't breastfeed, you shouldn't feel guilty, and you can tell anybody who tries to make you feel guilty to fuck off. It may be as simple as you just didn't know any better. It may be as simple as you have certain things going on that you just can't do it. No one has a right to get all up in your business. What did Kamala and Tim Walz say? Mind your own damn business. Your choices are your choices. You should never be felt like a piece of shit because you chose formula feeding. I formula fed, I breastfed. Both kids are fine and smart and healthy and whatever. Just stop. Stop making people feel terrible, people. You're like on some bullshit. Don't be a nipple Nazi. So I say that because we as moms already have enough to feel guilty over. We always think we're fucking up our kid. Well, you know what? Do what you can do to get through this, okay? Because depending on where you work, depending on if you're sleeping with the enemy, depending on who's watching your child, depending on what daycare you got to drive across town for, you may not be able to do this, and that's fine. You shouldn't be made to feel guilty. But if you are able and you feel like you could and you think you might, at least try those first 3 days, because remember what I said, it's an ever versus never. So if you ever breastfed to any degree, you get some of these benefits. Here's something else I want you to know, because I did it. Don't let nobody tell you you can't. Once breastfeeding is very well established, here's what I did just to make my life easier, because I was going to grad school, becoming a nurse midwife, and I had to return to work. I breast and bottle fed, sure did. After breastfeeding, like my baby, I would pump, and I made a lot. So I would pump, put it in a bottle, both sides, put it in a bottle, and that night, so I could get some sleep, my very loving, caring, adorable, doting husband, because you know I've been married 17 times, but that particular baby daddy was my husband, and he was good to me and my daughter. At that time, he would feed our daughter at night. So if breast milk is in a bottle and he's feeding her at night and I'm getting sleep and I breastfed during the day, I don't see the problem. Now, as the breast milk, started going down because I was pumping less and less and getting back to work, then he formula fed our child at night, and I breastfed the stored milk, because I told you, you can store milk in a deep freezer for a year. You can store milk in a freezer for 6 months. You can store milk in a refrigerator for 4 days, not in the door of the refrigerator for any of this. And room temperature, just pumped breast milk is good for 4 hours. There's a video on that as well. I just want you to try to teach moms that they don't have to throw the baby out with the bathwater. Do they smoke? Okay, yeah, that's bad, but it's worse not to breastfeed and smoke. You see where I'm going with this? Benefit versus a risk. Do they smoke pot? Yeah, that's probably not the greatest thing to do with breastfeeding, But again, smoking pot and not breastfeeding is worse. So smoke your pot immediately after nursing if you must, even though we all agree that's not a great thing to be doing. If you smoke or vape, vaping after you nurse is better than before. You see what I'm saying? If you want a beer or an occasional glass of wine, stop feeling guilty about this shit. Again, if you're an alcoholic and you're a pothead and you're smoking a pack a day, well, I don't know. Does the benefit outweigh the risk? I'm not sure about that. But one thing I can tell you is that an occasional glass of wine and vaping and then, occasionally smoking pot, they're not contraindications to breastfeeding. No, HIV is. That's a contraindication to breastfeeding. Substance abuse, heroin, crystal meth, and cocaine, yeah, those are contraindications. Chemotherapy and radiation, contraindications. You ain't gonna go out of here breastfeeding and getting a mammogram. No, because that's radiation. I hope I helped. Deuces.